Okay, so some patients come in and they say things like, oh, my mother had this, my grandmother had this, it's genetic. Losing the curve in your neck is not genetic. It's a functional thing because of the way we live. Okay, so I've been in practice since 1995. I've taken thousands of sets of x-rays and evaluated thousands of people's cervical curves. And I'm here to tell you that the vast majority of teenagers that I've x-rayed in this country have already lost their cervical curve. So we're doing a lot of this throughout our day, backpacks and things like this. But when a person loses their cervical curve, their head usually starts to go forward, okay? So as you can see progressively in these x-rays that are worse and worse, the person's head is coming farther and farther forward. Now our head is 8 to 12 pounds, so we all have this 8 to 12 pound version of a bowling ball on a stick called our neck. And if I had you hold up a bowling ball like this, you could probably do that for a few seconds, maybe a minute. But if I asked you to take that bowling ball and shift it 4 inches forward or 6 inches forward, all of a sudden you are unable to do that. And this is the strain we're putting our neck in when we lose the normal curve in our neck. So our bones don't have any pain nerves in them, okay? So when your bones start to move out of alignment, you can't actually feel that. But when your neck goes so far forward that your muscles start to spasm, then you feel that because we have pain nerves in our muscles. So a lot of times people go, oh, it's not my bones, it's not my bones, it's my muscles. Yes, you are right. The pain is coming from your muscles, but your muscles are trying to hold your head in place. And when you have lost the cervical curve in your neck long enough, the body says, forget this, these muscles have been in spasm for days, weeks, months. Let's just fuse those joints together. So what ends up happening is we get bone spurs at the tip to the fronts of the vertebral bodies, and way out here, the bone spurs start to connect to the segment above and below, and on the last x-ray over there, you can see that those joints have fused together. So your body will actually fuse the joints together when you have lost a cervical curve for long enough. So degenerative disc disease, degenerative joint disease, they're the same exact thing when you're talking about the spine. What happens when you have degenerative disc disease is that you lose the nice patent disc spaces here, so they get shorter and shorter. You get sclerosis or bony growth along the end plates of the segments, and you get bone spurs. Okay, so ask your doctor about this, but a lot of times you could put a cervical curve back in a person's neck. Now, a lot of people sleep with Tempur-Pedic pillows. I personally love my Tempur-Pedic pillow when I'm lying on my side to give support to my jaw and the rest of my head. But if people were to lie on their back for 20 minutes a night on a cervical roll, now I used to sell these foam cylindrical cervical rolls, but the foam breaks down every few weeks or every couple of months, and people generally have to buy a new one. There's a new, I'm going to call it a device, called a Denerol. Dr. Dee Harrison and et al. Developed this. The company is called Chiropractic Biophysics. This is the best thing since sliced bread. Now ask your doctor about this because it does not feel comfortable for everybody. But this will actually put a cervical curve back into your neck. And actually, Chiropractic Biophysics has promised that if you use a Denerol for 20 minutes a night for 30 days, you will have a better curve in your neck. So it says there are instructions in this. This is a pediatric Denerol. This is for children. A lot of adults that I give Denerols to, they have to use the pediatric one to start out. This is supposed to make your neck feel stiff. It's not supposed to feel comfortable. But it is very important for a variety of reasons to have a good curve in your neck. A lot of times people have terrible curves in their neck and they're not symptomatic, believe it or not. A lot of times people do have headaches and migraines. They have shown that 80% of all people that suffer with headaches are because of an improper position in their neck. But a lot of times people don't have outward symptoms, but believe me, this is affecting the tethering on your spinal cord. It's affecting your diaphragm, the way you breathe, the dynamics in your body, the physiology, the kinematics of everything that happens in your body. A lot of it is determined on the curves, the normal curves you have in your spine. Okay, thank you very much.